everyone, I'm Dr. Sohini ENT and Cochlear Implant surgeon based in Bangalore. Today is February 25th, celebrated as International Cochlear Implant Day in the memory of the first ever cochlear implant performed way back in 1957. Over several decades, the technology behind cochlear implant has improved manifold. Today, it's really a boon for patients who are suffering from profound hearing loss. It can give them back normal hearing and a normal life. Cochlear implants have indeed revolutionized the way we treat deafness today. In my clinic, when patients come with deafness, they have a lot of questions, a lot of apprehensions regarding cochlear implants, especially the anxious parents of the little kids who are having severe to profound hearing loss since birth. In this video today, I'll try my best to address some of those questions and concerns, apprehensions regarding cochlear implant surgery, the mode of working of the cochlear implant device, and the safety of this procedure. A cochlear implant is an electronic device which basically bypasses the damaged areas of the inner ear or the cochlea, that is, the hair cells within the cochlea. It restores back hearing to a level where the patients are able to normally converse. They can understand speech and environmental sounds up to an extent of enjoying music even. Thus, it helps a deaf and mute person to join back the mainstream society. Hearing aids are devices which only amplify or louden the environmental sounds. It cannot bypass or do the work of the damaged areas of the inner ear. However, a cochlear implant is a device which actually substitutes or does the work of the hair cells of the cochlea. Thus, a totally deaf person who was not actually benefiting from the hearing aid amplification can get back a normal hearing, can converse normally and lead a totally normal life by using a cochlear implant. Both children who are born deaf and younger adults or elderly people who are totally deaf on both the ears can benefit from cochlear implants. The children who are born deaf in both ears due to various risk factors and having severe to profound hearing loss who do not benefit from a normal hearing aid are good candidates for cochlear implant surgery at an early age. Older children or adults or even elderly people who are actually talking normally, hearing normally, leading a normal life, but suddenly or gradually due to various reasons lose hearing on both their ears totally and who do not benefit from hearing aids again are very good candidates also for cochlear implants because they already have developed a language and speech earlier. So the moment they are able to hear with the cochlear implant, they can converse normally. The cochlear implant device has two parts basically. An inner part which we surgically put inside the inner ear and an outer part which is worn behind the ear or at the back in the scalp, which looks somewhat like a hearing aid. This outer part also has a magnet which connects to the inner part through the skin of our scalp. Now, the outer part has a microphone which collects the environmental sounds and a speech processor which is present converts these sounds into some digital signals and they send these digital signals across the skin of the scalp into the inner part. The inner part decodes these signals and sends a very mild electric current down through the electrodes into the inner ear. This is how the nerve of hearing gets stimulated and carries it to the brain for the patient to understand speech and speak normally. This is a question which many patients keep asking us. As a cochlear implant surgeon, our aim is to diagnose early and intervene early. Nowadays, we can do cochlear implants in children as young as 6 months old. As the child grows older, beyond 5 years of age, the results are not really up to the mark. Even if we implant the child, the outcomes, the language development is not at par. Once the child is detected to be having profound hearing loss, it is very important for us to advise the child to start using hearing aids. I'll explain to you why. Because the part of our brain which is responsible for understanding speech becomes defunct over time due to lack of usage, because in a profoundly deaf ear there is no stimulus reaching that part of the brain. So therein comes the importance of a hearing aid. If the child keeps using the hearing aid, some amount of sound does reach the brain to keep it active and functional, till the time the surgery can be planned and finalized. In a country like India, there are various factors actually responsible for causing this delay. First and foremost, what I have seen is the acceptance by the parents. When we tell them that your child is deaf on both the ears and would need a surgery probably, they go into a mode of denial. It's very difficult for them to accept this fact, thus causing delay in taking the further steps. Secondly, there is a lot of misconception, a lot of apprehension in the minds of the patient regarding the safety of the cochlear implant surgery, which further delays the surgery, and they keep waiting for the child to grow up, get older, so that the surgery is safe. But that is not the actual truth. And thirdly, financial constraints, which cause again a delay in the surgery. But we must keep in mind that after a certain age, when the child grows up, even if we implant the child, even if the child can hear somewhat, the understanding will not be that good. They will not be able to comprehend the sounds, they won't understand the meaning, and thus language development will not be appropriate. Ideally, in a cochlear implant surgery, a very good success rate is achievable. With absolutely normal speech and language development, the cochlear implant user getting mainstreamed into the society and leading an absolutely normal life. Do you know some famous Hollywood celebrities are actually cochlear implant users in their daily life? However, there are some important points we need to keep in mind. The earlier implanted, the better. The younger the child is at the time of implant, that child is definitely going to have a better result than a child who is implanted at an older age. Secondly, whether the child was already using a hearing aid before the surgery took place. So, with the help of hearing aid, some kind of sound stimulus was reaching the brain. So, the center of the brain responsible for hearing and understanding the speech is still kept alive until the cochlear implant surgery is undertaken. This gives a very good result in a cochlear implant surgery. Thirdly, whether both sides are implanted at the same surgical sitting or not, that is bilateral simultaneous cochlear implant. This gives the patient a bilateral hearing on both the ears. Thus, they are able to localize or identify the direction of sound, which is important for a normal speech and language development. Another thing need to be kept in mind is the structure of the cochlea, whether the anatomy is normal or not. In rare instances, there is some malformations or abnormalities in the cochlea, by birth of course, where the child may not get the desired result. So we need to counsel the parents accordingly before the surgery. Also, to be kept in mind is the normal IQ of a child. For understanding of the speech, a normal IQ is essential. In some cases of mental retardation or maybe Down syndrome, we have seen that child may hear, but the understanding ability is not that great, so language development may not occur as desired. And very important thing to be kept in mind is the post-operative rehabilitation period, the AVT or the auditory verbal therapy. After surgery, everything goes on smoothly, the surgeon does a good job, the surgery takes place perfectly smooth. The child will get a very good result only when the adequate and good auditory verbal therapy is given to the child, as long as he or she learns to speak, learns to understand the sounds. So it is very important that a total teamwork happens here. The implant surgeon and the audiology and speech therapist should play an important part as a team. Doctor, it's been a month almost. My 3-year-old child has undergone cochlear implant, but why isn't he speaking normally? This is one very important query we keep getting from all the anxious parents. A child will not be able to speak normally immediately after a cochlear implant surgery. After the surgery, we wait for ideally 2 to 3 weeks for the wound to heal up. After that, the outer part of the device is being fit into the child, and the switch on and mapping happens. A switch on is when the device is turned on for the very first time, and that is when a child or even an adult starts hearing. They hear immediately. But for a child, maybe 1 year, 2 year, or 3 year, whatever the age is, who is deaf since birth, they are hearing for the first time. Do they know the meaning of the sounds? Do they understand what this sound actually means? Unless we understand, we cannot speak. So the parents have to understand this. They need to know that child will not be speaking immediately because they don't understand the meaning of the sounds. Therein comes the importance of the auditory verbal therapy, or the AVT, or in simple words, the speech therapy after the surgery, where day after day the child is taught the meaning of these environmental sounds. They now know they understand the meaning of these sounds, they comprehend, and then language and speech develops. It takes time. You have to be patient after a cochlear implant surgery in a congenitally deaf child. In older children and adults who already have developed a language and speech, but later on they lose hearing and then they undergo a cochlear implant, the moment the device is switched on, they start hearing the sound. They already have the language memory, so they understand the sound as well, and with very minimal help, with very little training, they can start speaking normally. That is the basic difference between the two categories of patients. The cochlear implant device is imported into India from foreign countries like the US, Austria, or Australia. The basic device costs somewhere around 6 lakhs, and the higher end models with much better features, they can go up to around 15 to 17 lakhs for 1 year. And above this, we need to add up the cost of medicines, the surgical costs also. In our mission for a deafness-free India, the government, both central and state government, and even several NGOs are taking up the responsibility to help the economically weaker sections of the society to undergo this surgery. We must remember, cochlear implant is a life-changing surgery for a child who is born deaf, or even for an adult who has completely lost hearing. It is a boon for them to get this implant done and to join back the society and start living a normal life. I hope today I was able to address some of the common questions which people have regarding cochlear implant. If you further have any questions regarding cochlear implants or the surgery, please feel free to ask me in the comments below. I'll surely answer them. Thank you.